Dr. Madhipati, submission of Module 6 coursework on macrovascular complications of diabetes. I'm going to talk about diabetic foot ulcer as one of the complications of diabetes. The diabetic foot ulcer is one of the most significant macrovascular complication of diabetes. The risk to a patient with diabetes is close to 25%, leading frequently to disablement and leg amputation. In England, foot complications account for 20% of the total NHS spend on diabetes care, which equates to around 650 million per year, or £1 in every 150 pounds spent. Why are people with diabetes prone for foot ulcers? Having diabetes increases the risk of developing foot ulcers for the following reasons. Number one, reduced sensation of the skin of the feet. A complication of diabetes called peripheral neuropathy, wherein the nerves that take the message of sensation and pain from the feet are commonly affected. Hence, by losing sensation in parts of your feet, you are not aware of any damage done to your feet. It's likely that you are prone to problems such as minor cuts, bruises, or blisters, which can increase the chances of you developing an ulcer. Another complication of diabetes is narrowing of arteries going to the feet, called peripheral vascular disease. Diabetics are at increased risk of developing narrowing of the arteries, which is caused by fatty deposits that build up inside the lining of the arteries, which reduces the blood flow to the arteries in the legs, which in turn leads to poor circulation to the feet. Skin with a poor blood supply does not heal as well as normal and is more likely to be damaged. Therefore, a minor injury will have prolonged healing time and is therefore more prone to infection and thus an ulcer. Chances of developing an ulcer are further increased if there is also reduced sensation, since one may not be able to feel the wound. This brings to the discussion the importance of annual foot screening, foot care. Research has shown that people with diabetes who take good care of the feet and protect their feet from injury are much less likely to develop foot ulcers. It's important you have your feet checked annually by a GP, a practice nurse, a podiatrist, or if need be, at the hospital diabetic clinic. The examination includes assessing blood flow to your feet by checking at your pulses at the ankles. In case of doubt, extra tests will be conducted to carry out to look for causes of narrowing of blood vessels. In addition to blood supply, checking for damage to the nerves of your feet and look for any loss of sensation. This is usually done by asking if you can feel the vibration of a tuning fork on your big toes or a nylon filament pushed against the soles of your feet. Wherein you will be asked to report any odd sensations in your feet, such as numbness or pins and needles. Checking the structure of your feet for any abnormal pressure areas, and to see if you are wearing the right shoes. So part of the annual foot screening involves looking for blood supply, looking for sensation of your feet, whether you are wearing the right shoes. And in addition to annual foot care, it's important we treat for other health risk factors in addition to diabetes. As a rule, the better the control of your diabetes, you are less likely to prone for diabetic complications such as foot ulcers. Also, where appropriate, treatment of high blood pressure, high cholesterol, and reducing any other risk factors will greatly reduce your risk of diabetic complications. In particular, if you smoke, you are strongly advised to stop smoking. So the take home message is good diabetic control is the sole importance of diabetic management, in addition to good care of your feet. Thank you.